The next item of the Humanitas program is a poem by Meemana Premathillake. Meemana Premathillake was a Colombo era poet of fame in the Sinhala literature. He was also the founder editor of the Sarasavya newspaper, the first artistic newspaper in Sri Lanka. He was a famous Sinhala poet and writer, but he was also a bilingual of fame during his era. Meemana Premathillake had several children, and his last son, his small son, Saman, named Saman, died in his very tender age, although we do not know whether he died of cancer or the diagnosis of the disease that took his life away. Meemana Premathillake wrote a heart-rending poem called Daru Duka, or the loss of a child, or the love of a child, roughly translated to English. The interesting thing about this narration is that I approached several very talented narrators who are doctors, who are announcers, who are singers, who are poets, to do a recording for Humanitas. About 3 of them refused, saying it is too sad for them to narrate because they too have children this age of summer. It was a very interesting observation and an interesting experience that I encountered while preparing for Humanitas. But one of our students, Santhushya Gunasinghe, took up the challenge, and he has narrated a few stanzas from this poem for Humanitas, which actually captures some very real and very profound feelings a parent will feel, a father will feel when a child is taken away from your life. Let's listen to Daru Duka. Over to you, Prasad.
දෙමාපියන් තුරුල්ලදා පොළො පසින් වැසී මලා කියා සොහොන් ගැබේ කුඩා බබෙක් වෙසේ මොකක්ද මේ කියා ලොවේ කෙනෙක් නොදන්නහු මහා සමුද්දරේ මැණික් ගලක් වගේ පුතා මිනිස් ලොවේ උපන්නොතින් හොඳයි කියා සගෙන් අවුත් මෙසේ මගේ ගේ මැණික් කොතක් ලෙසින් වුසු පුතේ ලොවේ ඉසිත් දොසුත් බලා ඇසින් යලිත් ගියාද නෑ ගියේ මගේ හිතින් දිවාරයේ ඉරයි හඳයි සොහොන් බිමත් සිඹී පුතාගේ රූපයෙන් බිඳක් අරන් මලු පිපේ විහංගයෝ මගේ හැඟුම් සුරල් හඬින් කියත් ලොවේ සියල්ලුමත් මගේ පුතාට ආදරෙයි වනී කුසුම් පිපී නැසේ මිලාන වී වැටේ සුගන්ධයත් වනේ මිසක් පිටස්තරින් නොවේ අහිංසකත්වයෙන් පිරි මගේ කුඩා පුතා අගේ මටයි එමෙන් මෑණියන්ටයි සුරන් කැමැත්තවුන් කලින් අපේ මිනිස් ලොවින් තුරන් වෙති කතාවකුත් තිබේ එයත් සැබැයි අරන් නොගොසන් සිතත් හදත් නුබේ දෙමාපියන් වරෙන් වරෙන් නිදාගනින් බිමින් නොවේ ගෙයින් අනේ හිරේ නුබේ රැසත් තදයි රළුයි සැරයි පුතාට ඒ හුරුත් නොවේ සියුම් නිසා බොහෝ සැපක් නොලත් නමුත් අපෙන් කුඩා වියේවුයෙන් වසන්ත කාලයේ මලක් වගේ සමන් පුතා ඉතා සියුම් අහිංසකත්වයෙන් කැලුම්බරින් පුතාමඳුන් සිනාව තාරකාවලින් පෙනේ. තරක් වෙමින් උඩයි බිමයි නුබයි පොළොතලේ වනේ කුසුම් විකාශයෙන් සිනාව මේ කියයි. අආ ඇෑ ඉී උූ එකයි දෙකයි තුනයි කියන්නටත් කලින් පුතා ලොවෙන් මැරී ගියා. බලන්න මේ මහාම විස්මයක ඒ වුණත් පුතා ලොවේ හැබෑ පුවත් ලියූ පොතක් වුණා.
That was Daru Duka by Meemana Premathillake. Nilufa, Nilufa, I think your face is not properly seen. If you can adjust. Yeah, that's good. Thanks. Nilufa, I think you listened to this heart-rending poem. Any reflections on death that you are comfortable sharing?
So it's we were given last 1 year. So I think with that 1 year we tried to give the best whatever he wanted, but certain things we couldn't do, like taking him overseas and all. But I don't know. It's very, he's though he's no more. The people say he's out of pain. But the best place for him, he's in a better place. But for me, the best place for him is with us. So I think, I don't know, I just can't, after listening to that, I just can't speak beyond this.
It's okay, Nilufa, thank you very much. Chamat, sorry, before I go on to Chamat, may I go to Professor Dinithi? Madam, in these works of art that we have discussed, it sort of touches upon some of the very strong feelings that parents undergo when a person is affected with cancer or with death. Do you think that, like a lot of people tell parents or loved ones who lose a loved one to cancer, especially because they suffer a lot, that they are that you must get over it. There's a pressure from society to get over grief, and so on. How do you think about it? Do you have any ideas about it?
Yes, actually, I have thought about it a lot, being a mother of 3 sons myself. I will give you an answer that does not come from me, but an answer that Somali Daraniyagala, who lost her whole family in the tsunami, has given to an interview when she was asked about this question. And she was asked about, like, she was commented about how resilient she was. And she said that people tell me that I am resilient, and people tell me that it is the resilience of human spirit that make us go on in spite of all the losses. But I'm quoting Sonali, like from the way I remember. It's not verbatim, but this is like what she wanted to say to the interviewer. And she says that it is not resilience that makes me go on. It is the fact that I first denied my loss, but then I looked at it in the face and I embraced my loss. I embraced my sorrow. Then only I found the strength to go on. So I think from a personal point of view, that is how I would also feel. Like, not by rejecting, not by denying that loss, not by trying to, kind of, we always use this term, come to terms with it. But it is like the pain will be there. The pain will always be there. The loss will be there, and we will live with it. But not by getting over that, but by embracing the feeling and then making it part of our life.
Madam, can I also ask you, because there's a lot of pressure, and I think Nilufa also very eloquently narrated, like sometimes they ask you if you have another child to test and help the other child who's not affected with cancer. But sometimes there is a sort of a suggestion that if you have another child or other children, but I mean, when you examine the narrative of all these patients and the literature, the arts, everything that suggests to us that it's actually perhaps a slightly unkind question to ask in the second sense, not in the first sense. And also, do you think that these legacies that cancer patients leave behind, for example, their parents support charities, for example, that father who bought a PET scan for the Apeksha hospital when his son died of the cancer. Do you think not getting over helps legacies to live on? Because if you get over the pain, then you're over it. But do you think this remnant pain and remnant love, I should say remnant love, the love that continues to live, it ignites charity and legacy?
Yes, as I see it, pain is the other side of love. It is the other side of the coin, and it's like it's actually like it mirrors your love. And I wouldn't want to, lose total. Like, I would want to feel it. And as for your if I go back to when breath becomes air. Like that is the question that was asked from Paul by his wife Lucy when they wanted to have this baby. Wouldn't it be so painful if you have her, knowing that you will have to leave her soon? But Paul's answer was, if that's the case, wouldn't that be wonderful? Because that's love, and pain arises out of love. So. And the other thing that you asked was about particularly when the doctors talk to the patients when one child is having maybe a serious illness, whether you have other children. So this may have different connotations, and the family might interpret it in very, very different ways. So therefore, I think when you use your words, when you speak to parents, when they come with a sick child, the doctors have to be really careful on their choice of words, because that might sound very insensitive when you ask about the second child, although as a doctor, you do it with good intentions.
Yes. Nilufa, can I ask one final question? Are you okay to take one final question? I think I just want to ask you, there is a forum of medical students and doctors here, and Nishad has today become a teacher to all of us. Remembering him, while remembering his brave life, do you have any message to our medical students who are going to be future doctors?
Yes, I want all the medical sector to look at the patients and patients' family, read them more than what you read now, because what the families go through is severe. Because we don't want to lose even a day. If we can give them more, that's what we want to do as parents. So the families, especially recently, I tried to contact my doctor to give a donation to the hospital, remembrance of my son. He said, no, I don't want you to give me a donation. I have a child. He said he comes to clinic, but I don't know how he's coming there. So he doesn't have where to come. He's going through a lot of issues in family, no food. So those things also there are when you look behind. So I want you to look into that. And another thing, we tend to, once there's a patient or a cancer patient, we tend to do other things like Bodhi Puja. We go to cut all the hammer, දෙහිගෙඩියක් කපනවා, හැම පන්සලටම යනවා, හැම පාස්ටර් ගාවටම යනවා, හැම සුරයක්ම දාන්න බලනවා. So that's one more thing from parents' side we do. So I think you all should not look down on that, because that's another encouragement we get in some other way to increase one day of life of my child, our child. So one more thing, I want to especially thank palliative care. At the last year of my son's death time, palliative care supported us very emotionally. A lot of support we got from them. So even for my son, they gave a lot of new way of looking at life. So that's I couldn't even tell you, Santhushya. That's palliative care was really good. We only got a very short period. He was able to go through it, but it was I think a new thing for us. Okay, thank you.
Nilufa. Thank you, Nilufa. That is my last question to Nilufa.